everyone. Tom Parks, Director of Retirement Plan Services with Annex Wealth Management. I am joined today by Joey and Taylor. We'll start with you, Joey. A little quick intro.
My name is Joey Backus. I'm an employee benefits consultant and help small to mid-market employers on their benefits plan structure and recruiting and retaining employees.
And Taylor.
Taylor Orton, Vice President and Director of our Wisconsin benefits operation, both in Madison and Appleton. As Joey, I also help consult with middle market employers, large employers on their employee benefit programs, and also oversee the success of our Wisconsin offices and our Wisconsin clients.
Fantastic. So the reason I asked you two to come in today is we are approaching open enrollment season, benefit season. It's a busy time of the year for us, and a lot of this is just selfish. I want to know what I'm supposed to be doing when our HR team comes to me and asks me some questions about benefits. So the first thing I think about, being a retirement plan guy is when we're dealing with prospects and clients, there's a big drive to push down the cost of our advisory services, of things like that. It's an understood, and it's an assumption, right? It feels like with healthcare, it's the opposite. It's just understood that you're going to be paying more, right? So am I understanding that correctly? If so, why is that the case? If not, what am I getting wrong? I'm throwing it out there to you two. What do you think?
It's actually kind of a travesty, really. That's why I'm in the business. And what's fascinating to me is I think it's a huge problem. And candidly, we've started to accept it as a society that it is what it is. Yeah. It doesn't have to be. And so I'm a numbers guy, and I get a little nerdy sometimes. And so when you actually dig into the numbers, because numbers don't lie, I'm a big believer in that. U.S. healthcare we spend about $1 out of every $5 of the economy is on healthcare.
So 20% of what we spend goes into healthcare.
Which is staggering when you think about that as a cost. And so when you dig under the hood a little bit more, it's like, well, is that normal? Where does that kind of, what's the size and scale of that is? When you compare it to other industrialized nations, so Canada, France, Germany, Australia, we actually spend over 2 times as much as the next closest nation in healthcare.
Wow. So 10% is as high as they go, and we're at 20. So we're doubling what our peers are spending on healthcare
on a per capita basis.
Why are we doing that?
So for a variety of reasons,
that much better? I mean, hopefully we have better. I hope we have the best healthcare in the world.
Sadly, no. We actually have some of the lower end from a life expectancy side of things and quality of care. And so when you we probably aren't going to unpack it today in 15 minutes, but there's a lot to it, and I'd boil it down to a few things. One, it always starts with health. The United States health is alarmingly poor. Okay. We have about twice as many people that are obese in the United States as these other nations, which obviously creates more care needs. We also have a real issue with sick care instead of health care. And an example of that would be these other nations average about 7 primary care visits a year. The United States is just under 4. And so almost half as much primary care utilization. And so people don't go in until they're sick, and they really need it because we're unhealthy as a nation. We also have a propensity as, in the healthcare provider market to almost overprescribe care or do more invasive things than necessary. An example of that is we have 20% more C-sections in the United States than these other countries. We have almost double as many spinal fusions as these other countries.
And you just had a baby, so you're familiar with this whole conversation, right?
It's kind of staggering in that capacity, and and I don't try to beat down on healthcare providers for what they do, but I think there's so much going on in the space that we probably have an opportunity to learn about these less invasive care paths and having people try things, like physical therapy, chiropractic care, alternative getting people back to where C-sections aren't the norm when you're going in and there's any complication.
So that's the patient and the doctor, right? Those things going on. But as you and I know there are a whole lot of people in between the patient and the doctor. There's the insurance company, there are the employers, because most people get their insurance from their employer. So how does all that factor in to impact this whole situation?
Yeah, I mean, people think insurance that's where all the blame always goes, insurance and corruption and all this stuff. And there is some there. There's definitely a lot of money in the insurance world, and there are definitely games. Sadly, it's the smaller component. I always say healthcare, when people's premiums go up, it's math with a margin, which means claims plus a margin associated with it. And the margin is a fraction of the actual claims. And so I go back to health, utilization of preventative care, and what we are prescribing at the physician level ultimately creates the math. And the margin's just a function on the side of that. And the bigger this number is on the claim side, the bigger the margin happens to be. And so the insurance companies really don't have a lot of incentive to go fix the problem.
Sure.
It's a moneymaker for them. Those are a lot of things that we can't control. But I think one of the ones that probably gives me the most like alarming feature is it's probably one of the only things that you would ever buy, healthcare is, as a patient, where you actually have no idea what the price is.
I was just talking about that with a coworker of mine. So what can we do to remedy this situation, or at least make it better?
Well, I don't think we could do everything, but there are some practical things I think employers can do versus what is standard in the market today. And I kind of give the example of, I love Amazon. So Amazon.com is, I probably buy everything, probably too much from there. And my wife loves it too.
A lot of us do, right?
And so what I love about Amazon, and it kind of goes back to some really simple principles of clear price. I love the reviews. Every time I'm between a couple products, I look at the star ratings and I look at the reviews, and that helps me pick. But it also gives me some recommendations. Right? This is an Amazon recommended product. And it's like, it's kind of weird, but subconsciously you go towards those things. And so if I'm an employer, employers actually are responsible for about half of the U.S. healthcare.
Oh, wow. I thought it was more. Okay, that's interesting.
No, it's about half. Right. The other is made up by the marketplace, Medicare, and Medicaid.
Okay.
And so about half of the total population, it's more than half the dollars, though, which is a topic for another day. But if I'm an employer, one of the first things I'm doing is I want to create clarity around price and align those prices to my personal spend, because a lot of employers, especially larger employers, are paying these claims themselves.
Right.
And so one of the first things that most employers don't do, we have a lot of terms in health insurance are deductibles, co-insurance, co-pays.
Yep.
Most people have no idea what those terms are. The average American doesn't. And the only one of those three that's actually clear is a copay.
Right.
People love copays because I know what it is. It's a price tag.
Yeah.
Imagine if you went to Amazon and they said, hey, this product might cost up to $1,000. Would you buy it? You wouldn't, because it doesn't have a price tag. So one of the things that we've been pushing for a lot of clients is get rid of deductibles, get rid of co-insurance. Just put a price tag on everything, put a copay on everything, and you can still get to the same cost share that you have today. So if you have a $1,000 deductible plan and employees are picking up 20% of the overall cost, you can construct that to all be copays, but everything has a price tag then. Which gives you a nice baseline then for the next couple things I would say is when everything has a clear price tag, you can now start delineating those price tags based on a couple things. One being what I talked about earlier, really incentivizing lower invasive, lower cost procedures. Right. So think of today, a lot of employers offer emergency room for $200 and urgent care for $100. Those two actually have a different price tag on the back end, where emergency room is closer to $1,000 and urgent care is almost $100. And so
yeah, and it's all behind the scenes stuff that I think that throws people off. So, Joey, in your experience, when you're dealing with employers, what are the conversations you're having about all this stuff to break it down, make it simpler for people, and actually move forward with some sort of progress that's going to help everyone understand things better and achieve better outcomes?
Yeah, that's a great question, Tom. Once you do what Taylor talked about of simplifying the structure and the plan design and allowing employees to be able to understand what they may be paying, as well as putting in place transparency tools that help them measure the difference between a high-quality provider or a low-quality provider, as well as the difference between a high-cost procedure and a low-cost procedure. Because you can go get a knee surgery for $20,000 or you can get a knee surgery for $70,000. And the quality measure doesn't always correlate with where the cost is at. Actually, we find that $20,000 knee procedure, knee surgery, may be a higher quality because it's an outpatient center that's all that they do versus a major hospital. And so you need to structure
there are
things
efficiencies
right,
there.
more efficiency there. And in life, you think something's more expensive, it's better. That's not always the case in healthcare. So set up the structure right, arm your employees with the tools to be able to understand what's higher quality and what's not. And then you have to give them something to help navigate all of those tools. Because if you just give them some kind of transparency tool or you change the structure, they may not understand it. And when people don't understand something, they're not willing to.
Well, that's
use
the
it.
classic having all the tools in the shed and not knowing how to use any of them. So what can people do? Because I feel like I'm in this position where, I'm a professional. I deal with employee benefits just on the financial side, not so much on the healthcare side. You would think that I maybe know more than the average person, and I feel like I don't know much at all. So when we go into open enrollment season here, it's, you need to pick these things, and I look at it and I'm just like, oh my gosh, I don't know what I'm doing.
So we encourage a lot of our client partners to invest in what's called advocacy services, and there's lots of different vendors that do this. Some are pretty basic and inexpensive, and some can have a high price tag on them, but we find that once you actually utilize those services, it creates a better member experience. It helps take pressure off of human resources that have been stretched pretty darn thin, especially
there's a lot of that
COVID.
going on right now.
And it can help, by creating consumerism, help your bottom line and help your health plan perform better. And advocacy services are things like you having somebody throughout your whole healthcare cycle to guide you, to help you schedule appointments, to help you use that transparency tool to figure out, should I have a knee surgery here or somewhere else, and what is my company going to incentivize me with for picking that better option for me, but as well as the organization as a whole. And then once you put that advocacy service in place, I think the last step, and one of the most important steps to wrap a bow around all of these items, is communicating it and creating buy-in from the top down within the organization. Right. Not just right around open enrollment like we're talking about, communicating once. Employee benefits and health insurance is such a big spend.
Should be ongoing. It's not like people only get sick during open enrollment time, right?
Right. And it may not be the most exciting item out there, but when people need to use it's really important.
Right?
Yeah, it's up there.
401ks
right
or maybe the
March
Green Bay
Madness.
Packers.
Well, okay, so then employers I find this in our industry, there was a recent study that Fidelity said 34% of employers are looking for new retirement plan advisors, and it's particularly focused on helping their employees better understand, investments and budgeting and basic finances and stuff, right? So the thing is, it takes a certain kind of employer to want to bother going into, because for us, it's a collaborative effort. There is only so much we can do if the employer's not helping us out, because it's their team. Mm-hmm. They know their people even better than we do. They are in charge of the schedules. So how important is the relationship of, getting the buy-in from the business people, the business owners themselves?
Oh, it's essential. You look at any organization, if they're trying to move the needle forward, it takes buy-in from the top. And it's really funny when we talk to some organizations, and a lot of them have the same story. We're struggling with recruiting, we're struggling with retention, our health insurance costs are going up, our employees don't understand our benefits, but also those are the same employers that aren't willing to do things different. And it's kind of insane if you're going to do the same thing over and over and over and expect a different result. And so we think that you have to change just like the world is consistently changing. And there are some employers that have more applicants than they know what to do with. I was meeting with a client earlier this week, and they are turning lots of people away, but they're also a client of mine that is willing and always forward-thinking, willing to change the game and do things differently than what they've always done.
And I think the world today is, we're obviously talking about health insurance today, but for a lot of employers, they haven't made it a priority. But if you did make it a priority, right now it's all recruiting and retention, and people are like, hey, how do I invest money into childcare for my employees? How do I invest in maybe tuition reimbursement? How do I go out and maybe give people bigger bonus? I have to raise base wages.
Yeah.
That money doesn't come from a tree. And so for a lot of businesses, for us, this is a big focus and a big priority to allow you to find some dollars that are buried in your healthcare plan to reinvest in your people, because today that's the number one issue.
Right.
But finding money to do the things that are essential to compete is really hard unless you're going to go after your bottom line, which really no business has ever been built on that premise.
Okay, so we've identified some of the problems, some high-level concepts on ways that things can be better. What are some concrete tips that employers can walk away with to say, okay, as I'm looking at this, I'm serious. I want to make this work. I'm willing to try something different. What are some things that they should try to make things better?
So I would actually say 5 things, and we'll see if we can remember all these. Number 1 is get as much clear pricing as possible in your plan designs. And what I mean by that is if you can remove deductibles, remove co-insurance, and replace them with co-pays that are clear, that is number 1. Number 2 would be, once you have those co-pays in place, to strategically have them low to high based on the value of a procedure. So making sure your outpatient surgeries are significantly higher priced than your physical therapy and your chiropractic care, making them maybe as low as $10, if not no cost. For your outpatient surgeries, upwards of $2,500.
So you're encouraging people to go to the more cost-effective
I want them to think about their treatment path.
Right. Okay.
So everybody has a different treatment path, and I really want to incentivize the things that also cost me, the employer, in the back end, a lower claim amount.
Sure.
Same thing on an emergency room, and urgent care is they have about $800 price tag difference between them. So we should probably have a bigger gap than $50 to $100 that are in most plans today. And so really thinking about those high value services, low price tags, versus the higher value or the higher cost procedures, higher price tags. Once you get through the procedures, it's about, as Joey mentioned, higher quality, lower cost providers. So if I am gonna go get my knee surgery done, that maybe instead of $2,500, if I go to an ambulatory surgery center and I go to that low cost, high quality provider, I could pay nothing. And really giving me an incentive that if I do take that care path and I do need to go to the more aggressive route for my care regimen, that I pick a lower cost provider, I get rewarded as well. 4 is we got to put in some tools to help people make those decisions, starting with that advocacy service that Joey mentioned, which is really having that single point of contact. It's the Amazon app is how I think about it, but with a call center tied to it is every time I need to think about care, I call, and this is an employer-funded service for employees. Obviously, Joey said there's a bunch of options, but me, the employee, I can go to this place every time, just like I go to my Amazon app to buy everything I want. I go to my advocacy either through an app or I call my dedicated concierge line, and I will get somebody that will help me book appointments, find the high quality, low cost providers, pick the procedures that are going to be the lowest cost for my plan, give me the sticker price that my employer has put together. That's clear. And after I get through all those things and I have the tools in place and the plan set up appropriately, the last one is probably the most important, which is communicate the heck out of it throughout the entire year and from the C-suite down. It can't just be, a lot of the time we see HR as the only team in the room. It really has to be a full leadership effort across the board.
I think that's huge. I love that that's part of what you're coming at here, because I think so much of this is we just, people talk about, you hear people say all the time, when they're talking about healthcare, well, insurance paid for it. And it's like, well, where do you think the insurance company gets all of its money from, right? So, like, the more that each person in this, series of people, from employee through employer, through insurance company, through medical provider, the more ownership people can take, the better it's going to be for everyone, right? And I don't know why you wouldn't want to. It's your health.
The more that people understand that
it's intimidating, though.
It is, and it's a very emotional and sensitive issue too. And that's why that advocacy portion, and also rewarding people for the decisions and making sure we're communicating why we're doing this. Because at the end of the day, insurance, they're going to make their money. It's a small portion of the whole pie, though.
So the rewarding part, we have an app, that goes through and it tracks behaviors. I've got this thing. I get points for my steps and all that stuff. And I'm not like the most competitive person in the world, but I am telling you, I want to hit silver and then gold and then platinum as fast as I can. And it helps with, it reduces some sort of out-of-pocket thing that we have at work here. So I don't know exactly what it's called, but I know that it's helping me save. So it does encourage me to take a little bit more ownership of my behavior, at least. I think that's
well, and honestly, if you're spending less on healthcare, you can invest more in your retirement, right?
Yeah, exactly. It all works around. And I do think, that's another thing, a conversation for another day, but the correlation between physical wellness and financial wellness, people who are physically unwell, it impacts their finances and vice versa. So this stuff really it does all work together. I mean, that's part of the reason the three of us are having this conversation, So, okay, so we've got some ideas. Did we get all 5?
We got all 5.
All right. So like I said, you want to try to remember at least a couple of those. Get something, start small. What else? What other things can we do? Because, is it going to work? People are going to wonder, how much time and effort am I going to have to put into this? I'm going to have to corral some other people. Yeah. It is going to take some effort. What are some words of encouragement for people?
My words of encouragement is the juice is worth the squeeze.
There
are other organizations that have done this, that have done these 5 things, and their statistics. One I reference for anybody that hasn't heard of it is a company called Bind Benefits. They do all 4 of the first things I mentioned, and they partner with employers that do number 5 with the communications really well. They have released a study last year. They opened up their doors in 2018. Newer startup company trying to change healthcare. Their 2019 client numbers, and they work with some large companies like Slumberland, United Airlines. They reported, Milliman did the study, 23% lower costs than the average employer, adjusted for demographics, risk, on an apples-to-apples basis. And it's because they're really changing how people buy healthcare. And so it works.
Wow, okay.
And it was even 11% lower than even the most progressive employers across the nation.
Well, and think about what you can do with that 20% savings on a pretty large spend. Then you can reinvest in other unique programs that our employees are asking for, extended parental leave programs, asking for larger investments in matches on their 401k plans, or being able to provide financial wellness resources on site, or mental health resources.
All right, awesome. This has been great. Thanks so much for all the information. I know we covered a lot of ground here, and teaser alert, Joey has actually a really cool example of an experience that one of your clients had. So rather than cover that here, let's whet people's appetite for some more information on another episode coming up ahead. So again, really, I appreciate you guys taking the time to come in. Look forward to having a little more of this conversation on another episode here. And for more content like this, check out the Annex Wealth Management YouTube channel, annexwealth.com, and feel free to reach out to these two fellows for all the good information they've been sharing. Thank you.